I'm Bonnie Tulk. I'm one of our general surgeons at Woodby Health. I've been here for just about a year, and I'm one of 5 general surgeons that we have right now. So critical for us to have really excellent visualization of our surgical field and be able to see the anatomy really clearly. That's what really allows us to perform a safe surgery and get optimal outcomes for the patients and prevent having complications. And so having lights that are staying in place and illuminating the surgical field and not distracting us by having to constantly reposition them, it really allows us to focus on the priority job at hand, which is, the steps of the operation and taking care of the patient. I think folks that haven't worked in the hospital, one thing they might be surprised by is how much a part of our day it is in the hospital is moving patients from one location to another, or from one bed to another, or from a chair to a bed, etc. It's a huge part of the day of everybody who works in the hospital, from the surgeons and the anesthesia providers to the nurses to our scrub techs. And so having proper equipment to move patients around really impacts everybody that works in the hospital. Having these beds with so many different capacities allows us to customize the positioning for each patient, keeping them safe, limiting things like strain on the patient's back or joints, or even, the worst case scenario of a fall in the hospital. We want to have 0 falls, and having equipment like this lets us achieve that goal. Alarms that tell the nurses or the care staff that a patient needs help or is trying to get out of the bed allows us to quickly respond and keep patients safe at all times while they are in and around our operating room department. It's so incredibly unique that Woodby Health is able to remain a community-owned and funded organization, particularly with the added support of the foundation and the foundation donors. It really feels on a daily basis when working at Woodby that we are taking care of the community, our particular community, and it's a reciprocal relationship where the community is supporting the hospital so that the hospital can support the community.